And then I am going now to another hospital in the northern Ethiopian region, Tigray, Eider. And we hear from a very different situation where Nairobi is maybe the digital savannah of Africa, the digital hub of Africa. The Tigray region has been out of communication since almost the beginning of the pandemic. So it's good to hear from you, and thank you for attending this conference. I hand over to Ida.
Good afternoon, everyone. I would like to thank the organizers of this webinar for giving our institution the opportunity to speak on the topic challenge of providing healthcare for the needy during war. Let me quickly give you brief background information about our institution. It's called Eider Hospital. It's a teaching hospital, and it's one of the largest such institutions in Ethiopia. It's a governmental institution. It's administered by Mekelle University, and I am the chief executive director there, overseeing both the hospital and the college. Our hospital is about 14 years old, and we had very humble beginnings, very few staff, less than 100, and only one specialist, a surgeon, and very few general practitioners. And in the last decade, with the support of our university, local and international partners, and also through the hard work of our staff, we were able to achieve quite a lot. And right now we have more than 100 specialists in various clinical disciplines. And before the war, our hospital used to serve a total catchment population of more than 9 million. And we had annual patient visits of more than 300,000 and major surgeries of more than 8,000 and deliveries more than 5,000. And we had modern medical equipment that we needed to serve our patients. And let me tell you what happened once the war broke out here in Tigray. The service literally nosedived soon after the war broke out 15 months ago, with a slight improvement in the middle. However, since the beginning of the siege in early July 2021, which is more than 7 months, the hospital service has deteriorated so rapidly, even though we have tried and are still trying hard to serve the public with whatever we can get. We haven't had a budget for the hospital for more than 7 months, which was supposed to come from the federal government. And our staff of more than 3,500 have not received their salaries for more than 8 months. And they cannot withdraw whatever money they might have in the banks deposited, because the banks are completely shut down. And our pharmacy, drug and supplies stock, which used to be more than 80% during the years before the war, has plummeted to less than 10 to 15%. And it's very difficult to tell people that we are trying to reuse gloves. We're washing them, sterilizing them, and trying to use them to serve patients. We're using traditional cotton-made clothes as gauze for wound care, and the use of expired drugs and supplies is being practiced widely in the hospital, and even that when they are available. Intravenous fluids, which have never been a concern for us in the past, are not available. Intravenous antibiotics, very common ones, we're not getting them. A few days ago, the Ministry of Health, through ICRC, sent us some vials, but it will not last for more than a few days. And we lost more than 60 patients who could have been saved or kept alive by using hemodialysis service, which is available only in our hospital. Just this morning, the wife of one of our patients in the hemodialysis came to my office, and she just told me that she was grateful that we were able to offer her dialysis using the consumables that we received from ICRC a few days ago. But she said she was not going to be able to get the intravenous fluids from the cities because she spent a lot of time looking for one, and whenever she got one, the amount of money that she had to pay was beyond her capacity. And patients who spent hundreds of thousands of birr out of their pockets or through NGOs on kidney transplantations and heart valvular surgeries done abroad have run out of the drugs they need to take for the rest of their lives. Chronic diseases are becoming increasingly difficult or impossible to manage. We are using expired kits to test for HIV. We cannot diagnose HIV in children under 18 months of age, and there is no CD4 count or viral load monitoring for patients who are on HIV treatment, and many patients are missing follow-up and drugs are in short supply. There's no treatment for hepatitis B and C, which are relatively common in our part of the country, and we were the only center where this treatment was available. Drugs for mental illnesses are not available. Cancer patients cannot get chemotherapy or radiotherapy. COVID-19 is completely forgotten. We don't have a vaccine, very few supplies for prevention and treatment, no PCR for diagnosis. We had it in more than 5 centers, but all of them are gone except the one in our hospital, and we don't have the supplies to carry out the tests. And items for surgery are in very short supply, and basic laboratory tests are not available. Spare parts for vital equipment, such as the oxygen plant that we own, and imaging equipment, CT and MRI, are not functional because the spare parts that are in Addis Ababa cannot reach us. Ambulance service has literally stopped in most parts of the region. Transportation cost has skyrocketed because of the serious shortage of fuel. Thus, patients are having huge difficulties reaching hospitals in time. Food for patients, linen, detergents, cleaning agents, we have to beg for those items to keep the hospital running. So you can imagine a hospital in a region that has been blocked for more than 7 months with no road or air access to other regions, no banking service, no telephone or internet service, very limited to non-fuel supply, no budget, frequent electricity outage, no salary, and yet we're forced to look at the faces of patients every day who are seeking solutions to come from our side, which we don't have. So this is indeed hell on earth, to use the words of the Director General of WHO. In conclusion, we ask our brothers and sisters in the world, through the international, continental, and regional institutions, to stop this man-made tragedy and allow humanitarian aid to come into our region very quickly and being unrestricted. I have huge hope that the upcoming AU-EU summit will deliberate on the plight of our people and patients in our part of the country, specifically in Tigray. We believe the world has all the tools in its hands to make that happen. We would like to thank journals such as the Lancet, British Medical Journal, and associations such as International Diabetes Federation, World Medical Association, and all the scholars, our partners, and other institutions such as ICRC, World Vision, and WHO that have either equaled our plight to the world or tried their level best to supply our hospital with whatever supplies the government of Ethiopia has allowed them to transport to our city. Thank you again, the organizers, for the opportunity you have given us.
Thank you, Doctor, for this very sobering account and really putting our feet on the ground in terms of what happens with a pandemic, what happens with a health situation in a situation of active war and conflict. I thank you, Dr. Amanuel, for addressing us here this afternoon.